our highly specialized surgical teams have brought endovascular thrombectomy, or EVT, to Newfoundland and Labrador, and that happened in 2022. This life-saving procedure for people who are suffering ischemic stroke must be performed within 24 hours of the onset of stroke symptoms. In 2023, we expanded our program criteria so that more stroke patients could receive EVT treatment. And now in 2024, we're very excited to see EVT expand even further, beginning with Central Zone. Our teams have also seen a significant increase in the number of ischemic stroke patients who are receiving clot-busting thrombolytic drugs. In 2023, almost 20% of eligible patients were administered thrombolytics, which is the national standard in Canada. Doctors try to give these drugs within 4.5 hours after the onset of stroke symptoms. Ongoing public education here in Newfoundland and Labrador has really helped people to identify stroke symptoms and to seek out stroke care urgently so that they can be diagnosed and receive drugs and therapies like EVT in time.
An early evaluation of EVT has shown that it has led to an approximate 50% reduction in the patient's length of stay in hospitals compared to patients who had not received it. This means patients who receive EVT have better outcomes and their hospital beds become available for somebody else sooner.
You know, we're in this place here in this province and we lead the country in terms of heart and stroke disease. And I truly think that we need to innovate in the way that we care and the way that we all treat this burden of disease that is upon us. After all, it's 1 in every 3 of us that's going to be affected. So as a cardiologist, I feel the hardship of people on the wait list longer than we'd like them to be there. I see how hard our heart teams struggle to connect patients with the care that they deserve and they should have. We do deliver care. We deliver world-class care. And as I drove here today, one of the things that I thought about, what is the most important message that I'd like to get across? And that is that patients should be very confident that when they come, they will get the best possible care. I believe that right to the very bottom of my heart.
So when a stroke is either caused by a hemorrhage or is caused by a blockage of the blood flow to the brain, that's an ischemic stroke. So if somebody gets an ischemic stroke, the sooner that clot is gotten rid of, the more likely they are not to have residual dysfunction, be gorked, as we say sometimes, and or die. So that whole process, pathway to care process, was the one that influenced the health accord the most. It thought about the pathway to care, the people recognizing their symptoms, an ambulance system that got them to a hospital with a CT scanner as fast as possible to determine whether they had an ischemic stroke or not, and then the application of thrombolytics or clot-busting drugs to get rid of their clot. That's a time-dependent process, and every minute saves time. So, and the thrombolytic drugs have to be given within 4.5 hours. So the fact that we have, during the time of the evaluation of the health accord and the recommendations provided to it, for me, it's a rejoice that we're now up to the national average.